states have a very productive discussion. The discussion is to facilitate how we can be effectively and improve coordination between finance and health officials. This will ultimately enhance the timeliness as well as effectiveness of response to the health and economic challenges posed by future pandemic, and also to promote exchange of experience and best practices among ASEAN member states. The ministers agreed on the following point. We noted the study on national as well as regional financial architecture for strengthening post-COVID-19 pandemic PPR in the Southeast Asia region. The study, which is identify a significant financing gap in relation to the PPR, pandemic preparedness and response, readiness in all ASEAN members countries, the modalities for investment, for strengthening national PPR capacity, and also in increasing contribution to and integrated with and effectively use the existing COVID-19 and other public health emergencies and emerging disease ASEAN Response Fund. We also reiterate the need to build momentum toward a strong and sustainable recovery by focusing on implementing the existing mechanism and strategies, as well as optimizing regional resources and ensuring the synergy and interoperability with global efforts, such as the Pandemic Fund officially launched by Indonesia during our G20 presidency last year in 2022. We also want to ensure that the ASEAN has increased the prevention, preparedness, and response capacity toward future potential public health threats posed by emerging and re-emerging infectious disease. We also reaffirm the commitment to increase national investment in One Health capacity and explore other innovative financing, including bilateral, multilateral initiative, by cooperating and engaging with international and development partners, and also to support the implementation of the ASEAN Leaders Declaration on One Health initiative. We also reaffirm commitment to strengthening regional health architecture beyond COVID-19. This is especially to achieve a resilience in the ASEAN community, considering the ASEAN Comprehensive Recovery Framework, or ACRF. We recognize the expansion of the COVID-19 ASEAN Response Fund to the existing COVID-19 and other public health emergency and emerging disease ASEAN Response Fund. We also agreed to expedite the finalization of the establishment agreement and preparatory phase of the ASEAN Center for Public Health Emergency and Emerging Disease. The COVID-19 and other public health emergency and emerging disease ASEAN Response Fund was to function as a pool of fund in response to the impact of the spread of the COVID-19 pandemic. The recent evolution of the fund has revisited the function to allow for more flexible use of this fund by also including other public health and emerging diseases. All 10 ASEAN member states, including Indonesia, contributed to this fund, including also funding which is contributed by the ASEAN Plus 3 Fund, in addition to the seed fund from the ASEAN Development Fund. The meeting also sets the stage for continued cooperation and progress in the ASEAN region health and financial landscape to ensure that we deliver what has been mandated by our ASEAN leaders. The outcome of the ASEAN Finance and Health Minister meeting will be reported to the ASEAN Summit that will be held from 5th to 7th September 2023. We reiterate our commitment to strengthen regional health architecture toward achieving resilience in the ASEAN community. To that extent, Indonesia would be keen to provide our ongoing support to follow up on this agenda, which is agreed by the Excellency Ministers today in the 2024 next year Lao ASEAN Chairmanship. Pak Budi.
Thank you, Ibu Sri Mulyani. We have learned from the last pandemic that every pandemic gave a huge impact on people's life or people's health and also country's economy or country's wealth. The second items that we observe in every pandemic is that pandemic has a long cycle, a very long cycle. Sometimes more than 50 years, sometimes more than 100 years. So it extends beyond several finance ministers or health ministers. So therefore, thanks to Ibu Sri Mulyani that initiated the first joint finance and health ASEAN meeting to make the relationship more structured and more formal so it can survive several cycles when the ministers are changed. Second, we also have agreed to establish and consolidate the existing funds in health sector in ASEAN to be a single one healthcare fund. So it can combine, integrate, synchronize all the type of funding modalities, either from private sector, public sector, and philanthropies, whether it is national funding scheme, a regional funding scheme, or global finance scheme. So we have, again, the size. And also we can see and disperse the money effectively and efficiently. So hopefully with this beginning, our region will be much better prepared for the next pandemic, and we will pass this gift to the generations after us. Thank you.
Thank you. Are we going to open for the question? Okay, enggak. Thank you so much for the media, and we'll see you this afternoon. We are still having a lot of activity under the ASEAN chairmanship of Indonesia. Today is the finance and health, and then in the afternoon and tomorrow for the finance minister meeting. Thank you so much. Terima kasih.
kind of more collaboration between the industry associations across ASEAN to make this happen. The call to action for the philanthropies, the NGOs, the manufacturing associations is to really help in upskilling and capability building. Now, of course, as the energy transition comes on a gross basis, there will be some jobs that might be at risk, but on a net basis, as I said, there is about 5 to 6 million jobs net that will be created. But this will need some upskilling, this will need some retraining, and that's a call to action to really create that supply base of talent